Hey, we're here at Bonnette Elite Physical Therapy and Wellness Clinic with Dr. Alex Bonnette, and we're asking some questions about his practice. And the first one, just so your patients get to know you and potential clients. Tell me a little bit, Alex, Dr. Bonnette, where you're from and about your parents.
Sure. So I grew up in a small town, about 5,000 people, out in southeast Texas called Silsbee. I was raised by my parents, Laurie and Jay Bonnette. They own a health club there, a mom and pop health club. They've had it for 37 years, so I was born and raised in the health club, and can say that I have the fitness and the wellness in my blood.
Why did you choose White as your location as opposed to, let's say, the middle of Fort Worth or Dallas or some other area?
Well, I realized that White Settlement was an up-and-coming area, and really there was no physical therapy here. So I recognized, actually, the nearest physical therapy clinic is 15-20 minutes away to the east side. And so I realized, it's an opportunity to help people that don't have it accessible. I mean, it's very hard for a patient to drive 15-20 minutes if they're in pain or injured. So being in this local area in White Settlement, I figured I could help a lot of people from a wellness standpoint and a physical therapy.
You have new technologies, new educations, wheels of wheel basically. But with the new technology, speeding up the healing process, either through ultrasound or, infrared, whatever you might be using, even with those advances, is old-fashioned rehab still needed?
Absolutely. Well, technology's becomes further and further every year. From what I've experienced, though, is that I feel like technology's become more prevalent in the surgery realm, as in surgeries are becoming more successful. But you still have to follow up with the rehab. It's very important. It's like I said, it's about half of your recovery.
Right.
The other half is first getting the surgery, the other half is getting your rehab. And so I believe that movement is life.
Doctor,
and life is movement.
I know you worked with other doctors, but what kind of doctors and why?
So we work with all healthcare providers, whether it's nurse practitioners, chiropractors, MDs, DOs, even non-healthcare providers. We're talking about yoga instructors and personal trainers. We feel like communication is key. We want to be able to discuss different treatment options that everybody is coordinating for this one patient so that we can get optimal outcomes for that patient. Well, what we first do is we do not need a referral to do an evaluation. So what we would do is we would sit you down, we would do a thorough evaluation and see if physical therapy is the right option for you. If we do decide that is the best route for you to go and do physical therapy, we call your primary care physician and we ask for a referral. And when we get that,
honest answer. Now, going back to insurance, what kind of insurance do you take?
We take all major insurances. I'm talking, we take Blue Cross Blue Shield, UHC, Aetna, Cigna, Humana, TRICARE, all the big companies like that. We also even take some of the smaller ones like Care and Care. It kind of depends. If you're not quite sure, just get on the phone and call us. And what we do is we'll verify your insurance and check.
So we're talking about Medicare and Medicaid. Tell me how that works, and do you accept that?
Absolutely, we accept both. And same thing, once we receive a referral from the doctor, we initiate treatment, and typically there's only a 20% co-insurance. So yes, and we also offer care credit, which is financing for any kind of medical or healthcare needs. So if patients are having trouble coming up with money immediately, they offer financing.
Okay, we're at the end of the interview. Tell people viewing the website in this interview why they should choose your clinic over anybody else's, doctor.
Well, I believe that people should choose Bonnette Elite Physical Therapy and Wellness because here we use a multidisciplinary approach for physical therapy, personal training, counseling, and nutrition. And we try and perpetuate a healthy lifestyle change for each individual. We don't want someone just to come in, have rehab, and be healthy and then come back in a couple of weeks. We want you to be able to be healthy and change. And here we offer one-on-one physical therapy. This isn't somewhere you come in and you're going to be one patient out of 6 at a time or 4 at a time. We want you to feel and actually become educated about your illness. And that way you don't have to worry about coming back here. You understand what to do.
And what are your hours? Usually Monday through Friday. Do you see people on Saturday? Is it by appointment, some special reasons?
We're open Monday through Friday, 8:30 to 6, and by appointment.
Okay, that sounds great. Well, thank you so much for the interview.
Thank you.